But how would you advise leaders to be able to strike the balance between driving performance and fostering well-being?
It's challenging to do, and oftentimes partly because we're handed the edict of the productivity expectations for the unit.
Yeah.
We don't get to decide that. It's oftentimes, assigned to us as a unit leader, and then we're supposed to make it so. But I think I'll say it often in my mind, it starts with understanding the team's why or the team's motivation.
Mhm.
And again, that is different than the organization why or the organization's motivation, right? The mission
Yeah.
statement of the organization, they're always nice and global and we promulgate, but that might not be exactly the way the team would describe their motivation and why they're, in your world of what really is driving us as pediatric cardiologists, right? And so it's understanding that team why, helping that, team develop that shared vision of what the team is hoping to accomplish, and then helping them see how that does connect with the organizational mission. And then again, I think once we have that, right, that we understand the team why, kind of a shared vision of what we're trying to do, how does it fit with that broader organization, even if there might be some additional elements.
Mhm.
To the extent we can, it's then also giving the team the objective and leaving the how to them. And I think this is one that we don't do well in healthcare.
Yeah.
And, if we're trying to ramp up productivity, rather than saying to the pediatric cardiologists in your team, Tom, of this is what we're being asked to do, it's not a nefarious ask. It's that, we had to give raises to every employee because inflation is up, but Medicare reimbursement is down. And
Yeah.
there's no way we can give raises to the people because we're getting paid less unless we see more patients. And so we want to treat our people right. That's our motivation. Um, but to do it, we've got to be able to see more. And our ask to you is this, and can you all as a team think about how you could serve patients in new and different and more effective ways that would accomplish that in a way that aligns for pediatric cardiology, which might be a totally different solution set than pediatric GI or a surgical practice. And there's creativity down there. People come up with different answers, and that I can see these kind of patients in a shorter way, and whatever it is, and these others.
Mhm.
That people can come up with those solutions. But because we don't trust them, and it's harder, and it might take us a little bit longer to let the peds cardiology team discern that, we do things like take control of the template centrally and shorten every visit across the entire ambulatory practice by 5 minutes,
Yeah.
which is incredibly ineffective, demoralizing. It disrespects the knowledge and expertise of the teams and represents a lack of understanding of, I'll say, to my world, what does a leukemia clinic visit look like? And what does it take to have the conversations about the circumstances people are dealing with?
Right.
And just shortening every visit by 5 minutes just reflects a lack of understanding and respect for the work. But so that to me is again where, to the extent we can, just give us the target and let us
Right.
figure out how we're going to meet it. And you can hold us accountable to meet it, but don't dictate how to us.
Yeah.
And so I
Yeah.
think that's the other thing of, is we think about trying to, support these well-being metrics, but also drive productivity. It's again, give people the objective, trust them with the how. You can hold them accountable, but that's the way you've got to do it. And then the last thing I'll say is sometimes even all of that's hard, but in parallel, also just constantly be improving the unit. So even if we got it handed to us and they said we are just shaving 5 minutes and we're stuck with it, there often are still other things we can do that you say, look, our cross coverage system isn't optimal when I'm on vacation, or the way we're assigning weekend duty, or the way we're rooming patients in our workflows has some inefficiencies. And if we could do this, I would be waiting less in between visits. And so that, how are we always identifying the opportunities? Can't do them all at once, but identify a small list, prioritize them, and keep whittling away at those things at the same time. That, that can also counter some of those higher level pressures.